we planned a conversation just to share some resources, explore some things. We wanted to spend time today talking about the current reality of staff and students, families, specifically the social emotional behavioral well-being, but we also have a resource that also reflects the academic well-being, if you will. And we have one resource that's new from the Center on PBIS, and we have some others as well as some practical considerations that are reflected in that resource. And then just exploring some possible new steps. Anything to add, Susan, to that?
No, we just really want to offer some practical ways that you can apply this kind of new space that we're in and learn from each other. So if you have ideas or you want to offer anything that your community is putting forward that you're really proud of, or that you would like the world to know about, I think this is a community where we are actively sharing and learning and leaning into this together, because we're all in a very new space that doesn't have a lot of research behind it. So while we know the kernels of evidence-based practices, and we're applying that in this kind of new reality we find ourselves in, but we're all going to really need each other and support one another, because this is going to be a long-term dynamic situation that we find ourselves in.
And so we're going to start with this first chunk, and it's perfect setup for this introductory thought, if you will. And that is this notion of upstream and downstream solutions. I'm sure many of you are familiar with the parable that goes with this. And Dan Heath has written a new book called Upstream, which I've found extremely valuable as one of my summer reads. But what we're finding is that right now, most of us have probably been operating in downstream mode. And that's a necessary part of our work as educators, mental health providers, I would say first responders, change agents, because that is the place where we're rescuing, responding, and reacting. And it consumes a lot of our energy, our resources, and it's necessary. What Susan and I want to invite for us to think about today is how can we create some space now to go and think of upstream solutions. So upstream solutions requires us to go further upstream to get in front of some of the situations that are problematic. So how do we think about predictable problems, anticipated problems, and how do we use our systems, our three-tiered prevention frameworks, to do the best we can to prevent so many of the problems that are going to land downstream, which helps us, as we know with three-tiered frameworks, be more efficient and effective with our resources and decrease the number of downstream problems, if you will. So we are going to spend some time thinking and invite you just to take a deep breath. We know we're all been in react, respond, rescue, and that's necessary. And can we think about how we can allocate some of our time to move upstream in our thinking and planning now to get in front of many of the issues. So take a deep breath, because Susan's going to navigate us through some of the current issues that we're all seeing.
Yeah, thanks, Kim. So I know that many of us are watching the news more than we ever have in our lifetime. And so I just wanted to bring a couple of items forward. And I think we're all very much aware of some of the awful numbers related to the pandemic that we see. And these reports come from the end of last week. But I also want to highlight that across our country, we have an unemployment rate that's surging because of the pandemic. And we've got about 32 million Americans now receiving unemployment benefits. And we know that has a significant impact on our communities at large. And so while we're looking at this data related to unemployment, related to increased homelessness, Columbia University estimates about 800,000 Americans could be experiencing homelessness by the end of the summer. I think as we're watching all of this in real time, it makes our hearts really heavy with the thought of some of our students and families experiencing these same trends, which will automatically impact our ability to navigate and help support them, especially in the virtual context, and when we're coming back in a face-to-face way eventually, right? And I just want to offer the current context because I think it's going to be something important for us to continue as leaders in PBIS and MTSS to raise to our teams as we go through the entire year, and to keep a good snapshot of what's going on in the national trend, but also the local trend data, because each of our communities might be dealing with different realities of the pandemic. Certainly surges and spikes in the virus might occur in different communities. So I think it's really important to kind of have that balcony lens about what's going on in our neighborhood, what's going on in our community that's impacting our ability to serve our students and their families, and what ways do we fortify and strengthen things that we do for everybody, right? Really hunker down on that tier one, because so many of us and our students and our families have been impacted. And so what you'll see on the next piece of current context is that this data also recently came out around the number of our children who aren't getting enough to eat. And so again, what are some of the data trends that you might be thinking about or worrying about, and how do we bring that to the forefront? And how do we, when we're talking with our staff in staff meetings, when we're having team meetings, how do we bring that larger context to the forefront on a continuous basis? And it really helps us with that perspective taking and keeps that empathy for what how we're all kind of approaching this new normal. And Kim, if we go to the next one. Thank you. I also want to really shout out to Roanoke, and I don't know if Jessica is on the line or joining us today, but I know that many of you in the communities that you're serving and have also had some really amazing innovative thinking in terms of when we first were in a shutdown mode and we had to stop school. We knew that many of our families and our students were not going to get enough food. And we know we needed to make really quick decisions. And when we ran into barriers, we didn't let those barriers get in the way of preventing us from having our families and students get the supports, in this case, food assistance needed. And so I just wanted to highlight that whenever barriers are going to arise over this year, I think we have to, again, keep this agile, nimble thinking and doing and action planning in the front of our minds as we move forward. So in this specific situation, they knew that a larger number of their students need to be fed. And but they didn't have enough resources to allocate and have every school be open. And so when they started to look at the data, they knew they couldn't reveal specific information about members of the community, but they could look at data in the aggregate that would suggest how to inform, how to reallocate and distribute those resources more effectively. And so what they did is they identified 4 schools with the largest need, and that's where they had and held their food distribution centers, right? So that's a beautiful example of a team working in partnership with others, because that's going to be a critical component of what we do moving forward. We will not be able to do this alone. We're going to need our partners to join us and really think critically at the balcony level about how to overcome some of the barriers by way of data that we're bringing in and how we're allocating limited number of resources. Same holds true with technology distribution and making, right? We're all in this agile thinking mode, and we just really wanted to highlight this because it's going to be such a critical component of how we move forward across the next couple of years, because we are going to need to encourage one another in our team meetings to be agile, encourage one another to think, to not let barriers get in the way of progress, and really be thinking creatively and innovatively. And I know that all of you are doing that. So I just wanted to give a shout out to that and make sure as leaders in this space that we're all helping one another stay in that kind of thought process. The other big worry I know we're all having at the moment is around the budget crisis, and that's causing a lot of stress. But we know if we're not focused on alleviating the stress of our staff, and unless our students' emotional needs and our families' social emotional needs are met, learning is not going to occur. And when stress occurs, I'm worried that we're going to hunker back and retreat to our silos, and we're going to seek comfort in those old routines and contingencies that shaped our behavior before. And again, how do we bond together and collectively call that to our attention so that we are not hunkered down, retreating to our silos? Because right now we can't afford to do that. We have to work collaboratively in ways that we haven't before, and we have to break out of our silos. And so as we build our respect, our routines for meeting, and our, Kim walked us through, what does respect look like right now? What does responsibility look like now? How can we bring those items forward and hold each other accountable to be in this space so that we are collaborating in new, innovative ways, and we're not seeking comfort in old routines that wasn't working for everybody to begin with. The other thing I really worry about is that a stressed and an overwhelmed workforce will increase implicit bias and overuse of exclusionary discipline practices, and it will actually inadvertently increase inequities. Specifically, when we come back face to face, whenever that happens, I think it'll happen in different moments of time for different communities. But I really worry that we're not calling attention and spending more time in staff wellness and conflict cycle and training and supporting our staff. So this idea that our team can hold the Maslow's hierarchy of needs upon return, that can hold the balcony view and understand the larger context of what our families and students are dealing with, and really hold this Maslow's hierarchy of needs, where we need to prioritize more than we ever have before the social emotional needs of our staff, the social emotional needs and supports of our students and their families. I can promise you this won't be easy. I can promise you this will take time, and we will mess up. And so we need to be patient with ourselves, and we need to be patient with one another as we navigate this new normal, but I promise you it will be worth it. And in the end, the silver lining will be that we have reinvented and redesigned a better education for more people within our communities, right? Because it wasn't working for everybody before. And here's our opportunity to completely change the game and to completely redesign it in the way that we all have input and support for one another as a collective, and a unified approach for moving forward. Another piece that I just wanted to highlight really quickly, I've been lucky enough to work with the Smart Center, Kelsey Schmitz, and the Northwest region of the country. And one of the things that, that we share in our meetings is a behavioral impact situation report that's put out by the Washington State Department of Health. And they always do a really nice job of giving very clear data points with respect to some key takeaways and some data trends that they're seeing within the community. And so I would offer this, and you might look at your local health departments to seek some of this data to, again, bring in that larger context that will help us navigate this new normal. And a couple of things that are some of the key takeaways in this area of the country is that roughly 1 in 4 adults in Washington are experiencing symptoms of anxiety at least most days, while 1 in 5 are experiencing symptoms of depression at least most days. In the week of June 22nd, suicide attempts, suicide ideation, and symptoms of psychological distress declined a little bit in June, but they are anticipating a full-blown increase starting in fall, when they look at the data around crisis and the lag time of a crisis occurs, and then the impact that has on our mental health needs. They also highlighted drug overdose and alcohol-related emergency visits, and highlighted some suicide cases among 13 and 17-year-olds spiking up when they compared it to 2019. They also noticed that handgun sales had increased, which means there are more guns in the home, and you pair that with increased depression, and we just need to make sure that we're being very, very safe when we see those increasing trends and call that out. So again, if we can bring in some of the community data to have that larger perspective, it's really going to help us think about ways we prioritize specific needs within our community, but also really this notion of fortifying tier 1 support. So I really want to applaud Washington State Department of Health, and I'm hoping that you all have access to some of this data.
I'm sure she's extremely happy that it paused right then and there. So we'll give her a moment to unpause, and I will attempt to finish her statement. Just to think, these partnerships and collaborations, and where might we bridge those partnerships, especially during this time. So we want to give you a moment. I'll leave this for when Susan comes back. I know it's her passion, but I'll very quickly, there is a resource that looks at the cost benefit analysis of PBIS and comparing that to, again, resources. If we're looking at downstream and upstream thinking, how are we using the resources to prevent much of what we've been experiencing? And so you can see some of the implications of the study that one of our partners, Catherine Bradshaw, led for us. But a net cost savings of $368,000 per 100 students for the elementary, and then $86,000 for students in secondary elementary. So we offer this to you if you're engaged in conversations with people who are working on policy, working on budget, engage them in upstream thinking to think about how can we reallocate resources. And there is a cost benefit to using this 3-tiered prevention framework. So we want to give you a moment to use the chat box just to, Susan's offered us much of what's we're facing in this current reality. And we want to offer you the opportunity. What are we, what's keeping you up at night? What are some other considerations that, worries, concerns, things that you find yourself losing sleep over lately? Yeah. Yeah. We are seeing a lot of negativity. I think that stems in part, at least, from fear and uncertainty, lack of not knowing, so many worries. Staff wellness, I think that is a critical thing that we must focus on at this time, absolutely. Inequity of education. How do we help kids be successful when they're not with us at school? Yeah, these are all very important considerations that you're raising. Support and recognition. What should my priority be? Gosh, that's $1 million question, Chris. I don't have the answer. I love that there's so many things. Yes, absolutely. We're going to look at some of what our national colleagues' expertise are recommending. So just to give us some thoughts about that. Supporting all the adults. Yeah, families that don't have access to technology, or families, my parents don't even have cell phones. And if I had a little one and they were caring for him, I mean, how would they navigate? How do we support families to support students, even if they do have access to technology? And what do we do when they don't? Yeah. So what does our multitude, our continuum of supports look like? Going through all of your comments. I hope you're all scrolling through these. So many are starting back fully virtual, okay? How do we reach all students virtually? Okay, we'll talk about some considerations for that. Mental health for all, yeah. Yeah. We should have done this closer to 5 o'clock, and then we could have had a carryover meeting, right? Let's see all of the things that are showing up for us. Culturally responsiveness, adult SEL support, yes. Ooh, I love that. The silos. Yes, Sarah. How do we look at, the spinning plates? I love that. To the separate spinning plates to that joint action plan, working smarter when everyone is at capacity. Absolutely. That's one of the big benefits of upstream thinking. We have so many resources, and if we just coordinated and came together, we would all sleep better at night, I would argue. So there's lots of what's keeping us up at night. Thank you for your contributions. School-wide norms online. We'll show you some examples of what some schools have done with that. So Susan lives out in the country, someplace in California, and her internet kind of goes in and out. So we'll keep an eye out for her to rejoin us, and hopefully that will happen. So we're going to move into, I just zipped right by that, this next chunk, looking at some resources and other considerations as you are constructing and working with others to construct possible roadmaps. And if you haven't finished your summer reading yet, I will tell you one of the most valuable books that I've read and reread over the last few years is by Tony Biglin. And what he does is he looks at the science of what happens when we intentionally do what many of you offered in the chat box, and that is, how do we create a nurture effect, a nurturing environment, not just for students, but for staff and family and communities. And welcome back, Susan. I think she's back.
I'm back, sorry.
No worries, we all just kept the boat going. I encourage you to look through the chat box at all the considerations that were raised about what's keeping us up at night. So he really offers us, and that's my actual copy of the book. You can see I've gone through it so many times and so many notes because I found it so valuable in thinking about how do we start to operationally define the skill sets we need as the adults and students and community to create a nurturing effect? And what if that alone, this huge protective factor of school, whether it's in person or now we must explore remote, was able to, prevent and impact so many of the things that are happening in our lives. So that's a very big balcony view. And some of our colleagues across the country are offering us very specific and agile thinking, as Susan would say, considerations. And so recently, Darling Hammond out of California, she's part of a collaborative, I might be getting this wrong, but somehow she's connected with Chiefs of Change and I believe Johns Hopkins. But I was studying much of what they put out for us. And some of the considerations that they offered us was, first and foremost, is to create affirming relationships within this positive, safe, predictable school climate. Very much aligned with the nurture effect and what Dr. Biglin offers us. And reconsider allocation of time. So those of you who are at that level where you can look at schedules and allocating time, flexible time schedules, as Susan said, thinking out of the box, rethinking how we're doing this and pulling our resources collectively. Considering the more nimble, effective staffing. So one of the models that I was really drawn to is this notion of small learning communities, which Susan will expand upon. But basically, it's thinking about, how are we utilizing our staff, our resources, either within a school building and or across a district. Where we're remote learning, we don't have barriers of walls of schools that contain our resources. So would it be possible that we could create schedules that allow teachers who really love virtual teaching, perhaps they're a lead on a lesson and they live stream that out. And the teachers who really thrive and have energy for building relationships work with smaller groups of students to build SEL, to differentiate instruction and build fluency with that explicit instruction delivered by the virtual lesson. But it's just thinking of how do we create an opportunity to rethink how we use our staff. I think about special education. I think about bilingual students and who in the organization of this education system speaks language that we might pair up with students across buildings to support families. So I said Susan was going to take a deep dive, but this is one of the things I've been exploring and I'm really curious about to know how schools might embrace this idea. a focus on social emotional well-being, no surprise, and just inserting our words to go upstream to really think about prevention for the different teaching and learning contexts. How do we create those structures and so forth? So what they've offered is for the first 2 weeks, and at a minimum, I was speaking to a team yesterday with a middle school, and the principal said probably 21 days to a month that we're going to prioritize building community, whether that's remote, face-to-face. In that particular district, they will be all remote to start off with. And he is giving permission, and I believe teachers need to hear this. We have permission. I'm demonstrating that by setting up a schedule. Pacing guides are there, but we know we've got to prioritize building community through relationship building, having fun with kids, using games to teach SEL, to teach routines and procedures. And we're going to look at how we can think about building predictable, safe, positive environments. And in that first 2 weeks to 4 weeks, what have you, how are we uncovering the academic and social emotional behavioral needs? And so the
Kim,
yes, please.
Can I just chime in? So I was watching the Major League Baseball. I don't know if anybody heard a game yet, but it was one of the most calming sounds in the background when I was doing some work on Saturday and Sunday. So it was amazing. But I just wanted, so if we're watching and following, Major League Baseball just opened, right? They just had their first full week. And there are a number of players that got sick and they've already had to cancel games. I think a lot of us are going to be going back face to face, perhaps. Some of us aren't, right? We're all in kind of different scenarios, but I think that we have the potential of following what just happened in Major League Baseball, and that we might need to go, we might have a bit of whiplash. We're back face to face or hybrid, and then we're all in a distance platform. And so when we talk about those first 2 weeks, if some of you on this call get the opportunity to have that face to face, it's going to be so much more important to make sure that we bond together so that when we do go into that virtual space right away, we have grown together in that first couple of weeks, and we're more likely to be able to engage in that virtual space, right? So nobody knows what's going to happen. Certainly, I'm not going to profess to know what's going to happen, but just watching other things open up and having to shut back down, I just think that might be a similar kind of thing that's going to happen with education. So anyway, I just wanted to offer that, and then how critical it is in that first 2 weeks to really think about gaining trust, getting to know each other, getting to know our stories.
Absolutely. Thank you, Susan. And Susan was actually one of the authors on this resource. So this is the resource, and there's a link to it here if you haven't seen this yet. It's quite lengthy. This is the only color I had, but it was green paper in the printer. But it's lengthy, and so we wanted to give you just a glance at it and then move right into some of these concrete considerations. We have a lot of resources coming out of our center, and I've been so grateful to help with some of those and even just be able to consume some of those. This one, what I love about this one especially is it was a collaborative effort between all of these centers that you see listed on the screen. So it includes, thank you, Sarah, it includes not only PBIS social emotional behavioral, but you can see our partners with literacy expertise also contributed to this. So it's not meant to be a summer reading where we're going from cover to cover. It's organized, and we're going to show you in ways where you can get to it, what you need, no matter where you are in the Cascade State District School classroom, and there are hyperlinks to resources. And so just to give you a quick glance so that you know what to expect if you download that, and Sarah shared the link, so thank you. The recommendations in this resource are grounded in the core elements of three-tiered frameworks, whatever you call those. And that looks like prioritizing equity. Many of you have offered us concerns about that. And I watched a really great keynote yesterday from Ambra Green, who is at the University of Texas, Arlington. She did this for Missouri's PBIS Center. And the beautiful thing that she did is she not only shaped the context with the data, she then pivoted to operationally defining what is it that we as the adults would do if we were working towards prioritizing equity. I'm finding that to be very critical in the work we're doing right now. So operationally defining what are the things that would it look like and sound like if we were doing this. Making student outcomes central for me looks like, here's a question on an agenda for whatever team meeting I'm at, and how does it impact students? Always adding that to be explicit in that intentionality here. The resource focuses on a small number. I can't emphasize that enough. We just want to get really back to the basics and think of a small number of things that are high leverage, high impact practices, and support the adults to do them well, and ensuring that they are culturally relevant. And always using data, you know, that is the heart of a three-tiered framework. Framework is using data to inform all of our decisions. And then of course, is systems for adults that we've been talking about. So some of the critical tools really are our triangles. We all have our tattoos in three-tiered frameworks, but this is a critical tool, and we'll look at, take inventory. If you have never looked at a resource map of what's in the continuum at the state level, the district level, the school level, take inventory now. What do you already have in place? And then as you explore your data, what do you have in place to meet the needs? Or is there even a gap in what you have in place to support the needs? And you need to look at your resources collectively. We're always putting these lenses, the trauma-informed, the culturally responsive, the equitable use of practices with the work that we do. And we know that as adults, it's probably going to be more difficult for us to apply those lenses if we don't build relationships, if we don't practice the skill sets that comprise empathy, such as perspective taking. The other critical tool is our circles. And so, you know, I used to shy away from these, but I have to tell you, these are the core of the work we do. And I was working with some secondary schools a few weeks ago, and we looked at predictable problems during this time. And one of the big predictable problems was that the high school students were not enjoying remote instruction. I said, well, why do you think that is? And they said, well, there's no social engagement or interaction. I said, well, then our practices need to provide opportunity for social engagement, social interaction. So think about how, you know, when we're looking at our roadmap, make sure we're looking at the impact of student for the outcomes, and then the connection and alignment between our culturally responsive data, practices, and the support the adults are going to need in order to implement these things well. So these are anchors in terms of the layout of the entire document. And when I see this cascade, if you will, this suggests to me that the work ahead of us is going to take the village. And what I appreciate about the what they've emphasized here is bi-directional communication. In where I live, our school superintendent has done a nice job of having these community conversations, open forums, surveys to get voice and choice from the community. And I think right now, especially, we're seeing that people need to be heard in order to feel seen. And so how do we create bi-directional communication, not just pushing out information, because then people get, you know, there's no platform for voice, there's no outlet, there's no productive way to gather that and use it. So I really encourage you to think about the key here, bi-directional communication throughout our cascade. So the anchors that Susan and I are going to look at and give some considerations for some concrete things that are in this resource are really this notion of getting back to basics, focusing on a few high leverage practices, high impact practices, build systems of support for us to do these things well. I heard a district say we have some new initiatives the other day, and I thought my hair would come off, which would be a lot, right? And so I think about no new initiatives right now. Let's really take inventory of what we have. If we truly need something, then we'll use the process that we've installed to decide for what we have to install that. But these anchors are what, how this resource is organized. And what you will see is that throughout this resource, again, it's not a front to cover read. It's okay, I'm at this level, the state level, the school level. And you can see these anchors here that we just showed you, that for each of these, whatever we're looking at, social, emotional, behavioral growth, or student learning, because remember, we had our literacy partners contribute to this, there are things to do. And there are hyperlinks throughout. So I'm really grateful for Sarah for posting this, because you want to use the electronic version of this. So as you're exploring and building your roadmap, if you hit a hiccup or you need some ideas, I would scroll to whatever level the cascade you work at, go to the place where you're struggling or you need some more ideas or you want to check your ideas, and then you can click to hyperlink to those resources. So that is really what you can expect in terms of the organization of resources.
The other thing I just want to emphasize, Kim, is that throughout this year, our center will be taking deep dives into different aspects of the document. So look for continuous support and webinars featuring different topic areas. So just wanted to put a shout out to the center and what we're going to be providing support around.
Thank you. And so I'm not going to spend time on this. I think I'm seeing that we're all well aware of this. We don't need any justification why 3-tiered frameworks are a great way for us to explore this. So we're going to look at just some concrete considerations, and we want to put on our balcony view a reminder to ourselves that really the foundational purpose of this work is to create safe, positive, consistent, and especially predictable environments for all of our students and staff. And so Susan's going to lead this part for us, starting with the priority first, and then we're going to go through some other examples and show you how other schools have been using things.
Yeah, thanks, Kim. And just a reminder that all of this work is done with a multidisciplinary team, and we need to be having a single set of teams within our schools that represent all aspects. So we're pulling in academic, social, emotional, and behavioral all into one team, one coordinated data piece, so that we have kind of the perspective of the whole child need. We also need to be leaning harder on our nurses and our public health professionals, both at or across the cascade. So really thinking strategically about how we pull our partners together in this work, and figure out using our data what the priority needs are and what can be put on the back burner for now. And that's an uncomfortable thing for a lot of us because we want to do everything all the time. And so it's going to be, again, really important to bring things to the forefront and say, what are 2 or 3 things we can focus on? What can we put on the back burner right now that we can address down the road? So within the workforce capacity section of this document is a little bit on staff wellness. So I wanted to take a little bit of a deep dive on that. So on the next bit of information as we return to school, we have always talked in MTSS about supporting and designing a system of support, but now we really need significant emphasis on designing that support for staff. We talk a lot about staff wellness, but with a lot of emphasis on the individual's responsibility. And now we really want to see across the cascade of implementation that we are intentional about designing a system of support for the adults in the building who are supporting our youth and our families. So with that, we need to address it in the same way that we deliver supports for our students. We as teachers to de-stress us, to have us feel more confident about going back to a healthy environment, and for us to be able to stay healthy, we need clear, concrete expectations and procedures and routines that might have varied based on where we find ourselves right now. We need direct instruction. We need opportunities to practice, plan, and build fluency with new routines and procedures. We need feedback, and we need those feedback ratios to stay really high right now because we are in very new territory. So right now, we just want to call attention from our district leaders and our state leaders to be, and our administrators in the building, to focus on de-stressing our staff. And we do that when we're explicit, when we script the moves for them, and when we provide platforms and opportunities to create small learning communities for both teachers and for our learners, right? Because we know, and I can't emphasize this enough, that a stressed and overwhelmed workforce will not bring our academic losses back back in line with what we expect to have happen. An overwhelmed and stressed workforce could inadvertently accelerate inequities, right? And it will cause probably us to have our immune system compromised even further, which is not the time to do that. So Kim mentioned earlier that we really are offering to bring professional learning communities and teaching teams together, right? We can bond together over Zoom platforms and virtual platforms, get to know each other, get to know our strengths, build community with these small teaching teams, and distribute the workload. So if I'm really good at webinar and virtual lectures, then let me hold that skill and let me do the little 15-minute recorded lectures. If somebody on our team is fabulous, can facilitate discussion in a virtual platform and is comfortable doing that, then let that person take the lead, right? Divvy up based on our preferences for what we want to do now, rather than thinking everybody has to do it alone. Same holds true with our learning teams, right? How do we build small learning communities for our students? How do we make it interactive and much more student-led, and listen to what they have to say in terms of what worked in springtime and move that forward into the now? Additionally, as we think about some of us who might be coming in person for the first couple of weeks or whenever that might be, I think it's going to be really important that we have opportunities, frequent opportunities for staff to be able to check in with one another. I think we should be expected to be emotional, exhausted, because we're learning kind of these new routines and procedures. And we should allow that common experience to increase our connection with one another, our sense of belonging, and allow us to be a little bit more vulnerable with each other and be honest about how we're feeling in the space as we go back into returning school. When we do go back face to face, it's going to be so important that we get an opportunity to practice those new procedures and we build fluency with the new procedures, because there will be new traffic flow. There will be new prompts in place. There will be new distancing protocols. There will be new safety protocols. So how are we going to be able to walk every inch of the building in small groups, physically distance, practice that so we can work and iron out all the kinks, so we're comfortable when we bring our families and students back into that that space. So we wanted to offer, you can go to the next one, Kim. We wanted to offer a sample agenda for that first face-to-face day back. We think it's really important that the district leadership convene a plan and build consistency across all of the schools, right? To have common procedures and protocols. And those are very clearly, hopefully, have been already developed by your district. So I know that there are little nuances in each of the states and districts that we're working with, but we really want consistency across all of the buildings. So we want districts and building level leaders to lead this work. And it could be that we start outside by having a welcome and check-in and just having time to be together. I know that when one of the first times I went to the grocery store or we did a physically distanced outdoor social event, I felt very overwhelmed emotionally, right? It took its toll, and it really quite surprised me. I think the same will be true when we come back together. So just spend some time together, have some music, just spend some time in that space. Perhaps use the new protocol for entering and exiting the building. Are you going to do temperature checks? Where are the sanitizer stations, right? The district and school leaders really need to model this for teachers so that we can then in turn model it for our families and our students when we bring them back. We should break into small teams and take a door and practice using those distancing protocols. We could practice the new traffic flow, become familiar with the prompts and posters and floor signs. We need direct instruction for all of our staff. I also think it's going to be really important that we, throughout the day, identify and are aware of places and moments that really triggered us from an emotional piece, because I think that when we bring our families and students back on, they will have a similar response. but they might not be in a place where they're able to control their emotions. And so we might see some really exaggerated behaviors coming back. And so if we can remind ourselves that we had similar kind of emotional unloading when we came back for the first time, it might help us with our compassion and empathy taking. And we might have a different response when we do see those extreme behaviors come back. Other considerations might be that we do huddles across the day, that we use the same orientation process with families and students. And we know that we'll have a small number of people who won't be able to wear a mask if that's one of the protocols that you would have in place. So it could be that we consider wearing some sort of identifier or medical bracelet that lets us know when people are exempt, so they don't have to deal with folks asking questions constantly that might take away from their experience when they come back. Day two, or the afternoon rather, sorry, could be that we break into small learning communities. We review the details specific to each age group. In Michigan, I know that the state has put forward that they want hand washing to be conducted every 2 hours. And I thought, what an awesome time to use that as an opportunity to build in our calming strategy and our calming routine, and be allowed to take a biology break every 2 hours where we dim the lights, we put on calm music, and we use our belly breaths to really stay calm, right? We could use that in conjunction with our hand washing protocol. I also think it's going to be important that we have an opportunity to practice these new scenarios, like what happens when we run out of soap, or what happens when we run out of sanitizer? What happens when one of our family members tests positive and we get a phone call? To be able to practice that and build fluency, and even the new fire drill with the new traffic flow, those are all going to be really important that will help de-stress us overall. And again, at the end of the day, have staff huddles, come back and develop these strategies and huddle spaces where we have time to talk, decompress, self-reflect, and really kind of understand that we're all going to be triggered in different ways at different moments in time. On day two, practice that same routine again. And really use the data to focus on different topic areas. I know a lot of us are very interested in screening and uncovering the needs. So that could be a topic area that we decide how we're going to approach that within our team. And we have time to facilitate conversation around that. Other topics might include empathy, perspective taken, and equity. Right? You all decide where the focus topics are in terms of what your needs are. But again, create a process where you're allowed to self-reflect, incorporate your own personal feedback, and have the system improve as we go through the process. The other piece that we're really concerned about is being overwhelmed, and there's a lot of things to be overwhelmed by. So it's important as we use the framework to harness all of the things we're overwhelmed by and align and integrate our efforts. So I wanted to offer an example from a newly released resource that we put forward, our trauma brief. And we created the trauma brief prior to COVID and prior to the pandemic. But I wanted just to offer one piece of that because I think it really resonates with our ability to integrate. So if we go to the next slide, Kim. I almost want to put this, this organizer in every meeting agenda, because when I hear folks say, oh, now we've done PBIS really well, now we need to start trauma-informed care. Or now we've done PBIS really well, now it's time to bring in SEL. And I'm going to argue that when you implement and expand your tier 1 components, you're already incorporating a trauma-informed approach and a social-emotional approach. So look at the tier 1 components on the left-hand side for a second. Many of us have already developed out and defined our teaching, our school-wide expectations, and we have rules and routines. We need to expand our teaching to include those coping skills, to include those social-emotional skills into the system that we've already designed for our behavior expectations, right? We can put those same type of lesson and teaching within the matrix and when we design our lesson plans, and we can embed and incorporate those into the fabric of our academic lessons. We can use morning circle routines for all of our classrooms in order to practice our new skills and build a sense of community. When we expand those expectations to move beyond behaviors and into the social emotional domain, we're hitting the social, emotional, and teaching reinforcing skills of building community relationships, of designing a trauma-informed approach, right? So we don't necessarily need to add one more thing. We need to fortify and strengthen our tier 1 components. And so you'll see within that brief ways that we've articulated and given examples around connecting these all of these things, so we don't feel like we're having to now do trauma informed over here and now do SEL over here. We're incorporating into the fabric of our tier 1 components.
Thank you, Susan. That brief is really phenomenal. It's been very helpful. I'm noticing we're at time, so I want to honor people's time. If you need to, get off this call, please feel free to do so. But I'm going to just give us a little bit more. And again, it'll be posted if you have other commitments you need to go to. Just to expand upon what Susan just offered, we've all been having to redesign our instruction as well. And because building relationships, connection, and communication, especially during this time, has been such a challenge for so many that we've been working with, we've been actually looking at, or what I might offer to those of you who engage in training and systems of support, is to dissect what it means to build relationships. What does it look like and sound like? And we've been doing that using a lot of Brene Brown's work, so that we can start to operationally define the skill sets that we want to build fluency with for teachers to teachers, teachers to students, students to students, school to family. So if you're engaged in training, this is one of those things that we've been doing, and we use those operationally defined skill sets to infuse into the matrix, because we want it to be a school-wide effort, to then inform how we respond to behavior with our flow charts, because this is critical. And the data that I've been asking schools about, what has been that level of connection and or communication or sustainability of relationships during this time? And many schools don't have data, and rightfully so, because they got notice on Friday that we were going to pivot. And then they were asked to pivot within 0 to maybe 2 days of preparation. But now we can take a moment and pause and think upstream, how are we going to use data to progress monitor relationships with every single student in our building? How are we communicating daily with all students? And for students who need more support, think of check-in, check-out. How are we, again, using our staff across a school, across a district, I would even offer, to fulfill the need of connection for those students who might need check-ins every hour, just like they would if they were in an in-person setting. So we've been doing a lot of work around this to operationally define those skill sets and working on different evidence-based practices and ways that we can do that. So I'm going to keep moving because I want to show you just a couple resources and then a few examples of remote learning matrices. These resources are available on our website. They're evidence-based practices. And now, how do we use these in a remote learning experience? So how do you set up a weight room so that as students enter your classroom, you are letting them in and you're connecting with them and you're leaving something fun, music, a little mind game, a question that they can respond to in the weight room, just like our local Trader Joe's are doing when we're waiting to get into their store. They're playing music and acting goofy to entertain us because it's a predictable time when we get agitated when we have to wait, right? Brandy Simonson at UConn offered us some great ways. So we might not, see the smiles, or we might be able to make faces and people can't see that anymore. I'm just looking at the silver lining, perhaps, I joke. But there are ways to consider other ways with remote instruction, like how are we translating these things? And again, to Susan's point, leverage your students, ask them, what would they do? What would be cool for them? We don't have to come up with all of this. We're not here to be right. We're here to get it right. So let's, increase that voice and choice in student engagement. There's a great resource that our colleagues just published about Tier 2. So what is check-in, check-out? What could it look like in a remote learning experience? How are we doing this? So again, thinking about your continuum of supports, this is what we had in place for in-person. How do we rethink and utilize our resources? And by that, I mean our entire staff, our custodians, our teaching assistants, paraprofessionals, school counselors, all of the people that are there to help us meet these needs. And so the matrix for me it is magical because, to Susan's point, I'm not doing all these things in a siloed way. I'm using the matrix as my social emotional behavioral curriculum. And that means it might be 5 pages long, just like our scope and sequence or our pacing guides for literacy or math. But it's our planning guide, and we're going to pull out the slices that are relevant during those different instructional times to remind, pre-correct, to reteach, to give reinforcement, and to give error correction. It's a teaching tool. And so what we want to offer in our training we've been redeveloping, which I'll give you more information about that soon, is leveraging this matrix to create predictability, not just for students, but as Susan said, for staff. So what's the predictability? What are the routines and procedures for using a remote learning environment? It gives us a way to build a platform for voice and choice in a very productive way, because as you know, you're not implementing 1.3 on the TFI with fidelity if you're not getting voice and choice and feedback into your matrix. It can't just be what these 5 people in the team develop. That does not represent the school community. So it's a way, a platform to engage families, to engage students for connection and belonging. And so some considerations that Susan offered already, there's going to be physical. With the district I work with, they're going back hybrid. So how do we teach 6 feet distance, right? For those of us who are, just don't have that ability to judge 6 feet, how do we use yardsticks or other visual prompts to teach that in the hallway, to teach it in the classroom? How do we get student voice and choice with this? How do we look at not just physical safety, but social emotional safety? So many school matrices have the operational behavioral skills. And as Susan said, use your matrix now to infuse it with social emotional competencies. What do you anticipate students might need support with? How do we use our matrix to create a teaching instrument that will facilitate consistency across students and staff? So you see, not only is it be on time, which might look like show up 5 to 10 minutes early for a Zoom class, it also means assume positive intent, right? We look at online. So how do we start to embed the social skills that we anticipate we're going to need to engage in this remote instruction? Here is an example of a remote matrix that my colleague Patty Hirschfeld and I have worked on, and I believe she just got on the call, but I believe it originated with maybe a school in California. And so for this particular area, they looked at the different teaching and learning context. So in a face-to-face or in-person learning, that might look like arrival. It might look like whole group learning, teacher-directed instruction, small group. And in a remote teaching and learning context, it might look like when we have synchronous virtual classroom, when we have asynchronous or independent learning at home. Not all of our students across this country have devices or access to a virtual platform. So some schools have utilized the school bus schedule as their mechanism for delivering instructional packets. We're having a communication box on the bus that we're giving communication and receiving communication. Remember that bi-directional communication. So how do we create predictability for that? And this school opted to put wellness, which I think is just brilliant because it gives us all permission to take care of ourselves and build that community culture to do what Susan suggested, that we focus on how we're taking care of one another. The thing that Patty and I thought was important to add and gives us a really good data source is at the bottom, many school matrices have a guide me or teacher support, like what could the teachers do to help the students gain fluency with the behaviors? What if we added questions for students and we give this to them? How can my teachers support me? Like, what do we know that they need? We can't anticipate everything, but we can get bi-directional communication to inform what we need. And how can my family support me? Like, what do the students need from their families? So then that gives us data to say, not all families understand how to build routines and procedures around these things. How can we support them? So I find this to be a really great data source, and we've been spending a lot of time with schools in our revised professional learning to develop these things and think about our experiences during this time and predictable problems. So I'm going to just go, I'm not going to talk to these things. I want to get to just some things that we're going to be exploring deeper in opportunity if you want to join us for some professional learning. But one of the things that many of you offered in the chat box was this notion of equity. And so, you know, how are we really rethinking discipline at this time and creating a system of support for staff to respond with grace and compassion, and us responding to adults with grace and compassion, and thinking about building that system and having that conversation. And I will tell you that Patty, I hope you don't mind me sharing a story, but she was working with a group, I think it was juvenile justice, and they did the relationship exercise. And what they discovered was that they were missing the skill sets of love as part of relationship building in their responses to students when behaviors surfaced. So it's just really starting to use your tools. Think about in a school, there's tier 1 practices, how we're fortifying those things to strengthen and help us navigate this time. Please don't go out and do something brand new. Use what you have. So just looking at time, just to reemphasize a few important things, please take inventory. If you're a coach working with a state, a district, or a school, hit the pause button, take inventory. What do you already have? And as Rob Horner would say, and George Sugai would say, what's the smallest change adjustment we can make for the biggest impact, right? Keep it basic. And use your data to inform decision making. So the here's what, so what, now what is a really incredible structure that we've used for many years with any data set you can see listed here. But what it does is it elicits perspective taking and feedback and self-reflection on data. So we're not just using our data, but we're using structures to engage one another in conversations about data that can lead to solutions. So take inventory, use your data, but use it using structures around the data to get to solutions. So thank you for staying with us. We will, just a reminder, email everything out to you all so that you have things. This PowerPoint, since it's us, will be in PowerPoint version, so you can cut and paste it. Some of you were asking for some of these, so we don't want you to recreate the wheel. We'll get those to you shortly. Enjoy the rest of your week, everyone.